Step 19, finance. Before you start your IVF treatment, you should have full understanding of finances of your IVF cycle. This will help you to minimize the stress related to the finance. So in order to do that, you need to have a full understanding of fees, what do you pay, who pays, when you need to pay. And then also you need to understand each item of fees. So here I will give you overall explanation. So here first I will explain item categories, what you're paying for, cycle fees, what's included in those cycle fees, who will be paying for your treatment, and payment time. So in terms of item categories, generally they are linked to these items: drugs for IVF, tests involving IVF treatment, ultrasound scan, consultation fees, embryology fees, and other types of fees, and also procedure fees. So in terms of these fees, you need to really understand if any of these fees or all of these fees are included in your overall global cycle fee. So generally, so there's three different types of cycle fees. One is all inclusive. You just pay once and you don't need to worry about any payments. And second type is pay as you go, which means you pay for the items in the cycle as you go. And then hybrid. It can be in combination of both. You pay for most of it through the cycle fee. Then for additional items, you will have out-of-pocket costs. In terms of source of fees, there are four different sources. One is out of pocket, and actually it means that you will be paying yourself. Second is using through government insurance like Medicare, Medicaid, so and any other government healthcare system insurance. And also the third one is a private insurance. The fourth one is a free of charge. For example, some clinics may not charge for certain items. So then payment time requirements, you need to really understand whether you need to pay before actually the cycle or before you use those items, or you can pay after. So that, okay, now I will go item by item so that you have a full understanding of each item. So essentially, again, as you go through item by item, you need to just tick on your chart. So whether you are paying out of pocket, whether it's getting covered by Medicare, whether private insurance covering or included in your cycle fee, or it is free of charge. So essentially here the first item is at cost is for investigation. Of course, your IVF starts with the investigation. So you need to really find out who is paying for female investigations, all those blood tests, ultrasound scans, in male investigation during baseline workup. It's even before your IVF treatment. You start tracking from there. From day one, you start tracking all your fees. So, and the second is a consultation. You have a consultation with a GP, consultation with a specialist, consultation with nurses. Maybe you need to have a consultation with a counselor, other specialists. So you need to really track and find out how much you need to pay for those consultation and who is paying, whether you are paying or it's included on your Medicare. So you need to keep a track of all those fees and clarify it before your consultations. So the next, once you started IVF treatment, just even before starting IVF treatment, then you need to buy drugs. Typically IVF drugs are very expensive. If you buy out of pocket, they're one of the most expensive parts of IVF. So really for the drugs, you need to find out how many drugs you need, names of the drugs, and you need to find out, is it included into your Medicare, so is it subsidized, or you need to pay yourself. If your insurance is going to pay, you need to really clarify before you start IVF, before you purchase the drugs, because this is one of the most costly parts of IVF treatment. So the next is a cycle fee. Most clinics offer cycle fee. So really, even in the cycle fee, you need to find out, like we said earlier, what's included in your cycle fee and who is going to pay. Is it going to be subsidized by your Medicare, or you're paying yourself, or your private insurance is going to pay? So the next fee is monitoring blood tests. When you're doing IVF, you do number of blood tests and ultrasound scans to monitor your ovarian response. Normally after about 5 to 7 days after stimulation of drugs, the stimulation of your ovaries, you do monitoring of bloods to check how your ovary is responding. So for that, you need to do ultrasound scan and blood tests. You need to again find out who's paying for that. Is it included in your cycle fee, or you are paying yourself, or your insurance. So next big fee is a procedure fee for egg collection. Egg collection involves admission to a procedure room or operating room. It involves giving you anesthetic, and usually you need to pay for admission in anesthetist. So and some clinics may charge even specialist cost. So you need to really clarify what's actually fee, itemization of those fees, and total cost of those fees, and who is paying. Is it included in your cycle fee, or you are paying yourself, or your insurance covering, or Medicare? So the next fee some clinics charge is a lab fee for fertilization. So fertilization can be done through IVF or ICSI. ICSI involves more manipulation of the eggs and sperm, more time from the scientists, and some clinics charge additional fee for ICSI. The next fee is a lab fee. Some clinics charge lab fee for using certain culture mediums or certain interventions. So you need to really find out if there is any lab fee. So sometimes these fees can be hidden, so you may assume there isn't any additional fee outside your cycle fee, then you may receive a bill which can be quite bad surprise. So this why you really need to find out if there is any fee linked to any lab interventions related to handling your eggs, sperm, or embryos. So the next fee is a freezing fee, because freezing of eggs, sperm, or embryos involves using certain culture medium that costs clinic money. So that's why they may need to charge additional fee, or some clinics may just add it into the cycle fee. You need to clarify. So and embryo storage. So sometimes it may be included in your cycle. You really need to find out how much you pay for embryo storage, or egg storage, or sperm storage, and how often. So who is going to pay? Is it your insurance, or you will be paying for those costs? So then embryo transfer is the second procedure. It's much simpler procedure than egg collection. You don't need anesthetic for that. So again, you need to find out if there's additional fee for embryo transfer. Then after embryo transfer, then you do pregnancy test. So approximately 10 days after embryo transfer, you use a blood test to check your pregnancy. Usually you do a couple of pregnancy tests. So again, you need to find out who's paying for that and how much it is. Then hopefully you will have a successful cycle. Then you will have ultrasound scan. So then again, find out who is paying for that scan and cost of that scan. So in some cycles, your IVF may need to be cancelled. For example, if your ovary is not responding very well, if you have any problem, medical or social problem during IVF treatment cycle, so IVF may need to be cancelled. Cancellation can take place during stimulation, on the day of egg collection, after the egg collection, before embryo transfer. Really, you need to find out about the cancellation fees, and whether you need to pay additional fee for cancelling the cycle, and who is paying. Is it your Medicare covering, or you need to pay out of pocket, or your private insurance covering? Usually, even if your cycle is cancelled, it involves a lot of work from the clinic to set up your cycle and monitor your cycle, a lot of hours from specialists and nurses. Usually the clinics charge cancellation fee. Some clinics may not charge. You really need to find out and ask the question. There are two different type of cancellations. One is for medical reason, or the social reason. So if there is any difference in the cancellation fees, if you cancel due to medical problems, or just because, for example, due to social reasons. So okay, so then other types of fees may be out there, which is not included in this step. So yeah, you really need to find out. Best way of finding out, just sending email saying, so I got this fees written down here. Is there any other fees which is not included here? Then clinics will need to list if there's any additional possible fees you may incur. So yeah, so understanding of your fees for IVF before your IVF cycle is by far the biggest factor to minimize your stress linked to IVF.